All right, this is everything you want to know about COVID-19 and the vaccine. There's been a lot happening lately. We knew we were going to have some upcoming news, so let's go over everything. My name is Dr. Valda Crowder, also known as Dr. V. I actually this week started a new position as the medical director at University of Pittsburgh Medical Center and Pinnacle, which is located actually not in Pittsburgh, but in Harrisburg, Pennsylvania. You can follow me on @AskDrV. And also I have all the source documentation on my website, which is AskDrV.us. All of these presentations, but not the Q&A, are taped. And they're also all dated. And today is February 2nd. Let's get started. Structure of the webinar is the same, 20 to 25 minutes, and then Q&A for 30 to 35 minutes. There are some slides that I always keep because we have new people joining us all the time. So if you've been on the webinar before, I request that you just be patient. When there's a couple of slides that you've seen before, the new information is intermingled. During the presentation, everyone's in listen mode. If you want to ask a question, feel free to type it in the chat icon, or you can type it in the Q&A. And I take the written questions and we just begin answering them. You can actually begin typing during the presentation. So if you have a burning question, start typing. All right, so the intention is to keep webinar participants informed with COVID-19 science that will help you and your family stay healthy during this pandemic. The outcome is that you will leave the webinar motivated to create or improve an action plan for yourself and your family. Or you may be motivated to create or improve an action plan for a broader community like a union or a school or a church or a business. Well, some of the recent news that came up, Andrew Yang, who ran for president, had the Yang Gang. He just recently, as of today, announced that he tested positive for COVID-19. Another thing that people have been asking me about is how they can boost their immunity in this time. They want to boost their immunity whether or not they've been vaccinated or not. This was a very interesting article in the Washington Post. Basically, what works the best is sleep, exercise, diet, and specifically by diet, low on the carbohydrates and low on the alcohol, and then cutting or decreasing your stress. So those are the things that really boost your immunity. We had at Dodger Stadium in LA, some anti-vaxxers shut down the vaccination site over the weekend. This is obviously not helpful. Obviously, if you don't want to get a vaccine, that's one thing, but interfering with other people getting a vaccine is a totally different story. Also, the Biden administration just recently cut major red tape. We will see a difference with this immediately. So currently, 100% or almost 100% of the COVID vaccinations are being administered through your public health department. That's why I often tell people, find out what county you live in, and then go to the public health department for that county, and then look up, trying to get an appointment. Biden administration is now actually announcing that they're going to do direct shipments to pharmacies. So that means that you should be able to get your vaccine at Giant, Walmart, CVS, Walgreens, Rite Aid, any pharmacy that you actually, Costco, any pharmacy that you normally would go to. Globally, these are the pandemic statistics. We're up over 104 million cases globally. The United States is responsible for 26% of that, almost 27% of those cases, even though we're only 4% of the population. Similarly, with the deaths, there are 2.2 million people around the world that have actually died as a result of COVID. In the United States, we're at about 454,000, which is a huge amount. It's more than died in World War II. It's a very, very large amount. All right. I've talked to everybody about the fact that I'm not flying. So I just want to show this. I want to make sure that people know that there are certain airlines, they're not mask available or they're not cleaning their flights. All of the airlines except for Delta are selling the middle seat. Delta Airlines is the only one that is not selling the middle seat. And apparently they said they were going to hold the middle seat open until March. However, it's still really not safe to fly. Canada requires a COVID-19 test within 3 days of flying before you can actually board the plane. Despite that, they've had 70 flights since January 7th that have had positive COVID patients on them. Some of them have had more than one COVID patient on them. Now, Canada has a very, very robust public health system and a very robust health system and contract tracing system that we do not have in place. So they notify the passengers on board within 24 to 48 hours, and then make sure all the people on board get tested immediately. All right, so now let's talk about travel. I just wanted to share with you guys what Dr. Fauci says about traveling, and he's specifically talking about traveling even when you get vaccinated.
Screwball Peanut Butter Whiskey, a refreshingly unique taste on the world's most classic spirit. It goes down smooth with a perfectly blended finish. Anything but ordinary, and always lives up to the name. Sure, it sips a little different, and that's just who we are. Peanut butter. Screwball Whiskey, the original peanut butter whiskey.
One of the worst parts about the pandemic is not being able to travel freely to see our grandchildren. My husband and I just got the first dose of the Moderna vaccine, and on February 19th we'll get the second dose. When will we have immunity, and when will we be able to travel?
Now, we just heard Dr. Walensky say now is not the time to be traveling, but what about this type of situation specifically?
Well, you know, what the person who called that question in said, when will they have immunity? Well, you can get some degree of protection, some degree that isn't durable, 10 days to 14 days after the first dose, but you can't rely on that. The maximum immunity begins about 10 days to 2 weeks and beyond following the second dose. That goes for anyone, regardless of whether you want to travel or not. That would give you, as a group, about a 94 to 95% efficacy and a good safety profile. The situation, though, does not change what Dr. Walensky said, that it is not a good idea to travel, period. I mean, if you absolutely have to travel and it's essential, then obviously one would have to do that. But we don't want people to think because they got vaccinated, then other public health recommendations just don't apply. One of the biggest things that are really not well understood is people ask, why should I even have to wear a mask after I get my second shot? And the reason is very clear, that the primary endpoint of the vaccine trial was clinically apparent infection. So you could conceivably get infected, get no symptoms, and still have virus in your nasopharynx, which means that you would have to wear a mask to prevent you from infecting someone else, as well as the other side of the coin, where you may not be totally protected yourself. So getting vaccinated does not say now I have a free pass to travel, nor does it say that I have a free pass to put aside all of the public health measures that we talk about all the time.
Yeah. So you're saying that the vaccine does not prevent necessarily against infection. Are you saying that that's the case, or we haven't shown it yet? Do we still have to just prove this out, Dr. Fauci?
Right. We don't, Sanjay, very good question. We do not know that as a fact, but we can now, as we get a few months into the follow-up, what we will be able to do is quantitative assessment of the amount of virus in the nasopharynx of a vaccinated person who got an asymptomatic infection compared to an unvaccinated person who had an asymptomatic infection. And then you can make an extrapolation from that, that if you have such a very low level of virus, it's unlikely that even though you were infected that you would pass it on. But we don't know that yet. that associated with cohort studies where you actually look specifically at the spread, you'd be able to sow it. Bottom line, Sanjay, this is an assumption that I think is reasonable, but we don't know the facts yet. That's the reason why we have to do this study.
All righty. All right. So what we know to respect COVID-19 is highly, highly contagious. Minimum amount of time to exposure to affect others is 45 seconds. With some of the variants, the UK variant and the South African variant, that 45 seconds is 15 seconds. As far as percent penetration, about 60 to 80% of the people that come in contact with COVID-19 actually get COVID-19. We've talked about the fact that it's a droplet and airborne. A droplet is a larger 5 microns and more in diameter. Airborne are the smaller particles. And basically it looks like this. The red is the droplets, and they drop a little bit closer to the person. And the gray is the airborne. If this person is COVID-19, you can actually see what a big difference a mask would make to all the people that might be around him or near him. We've talked about the mask. This is a really, really good time, if you haven't done it already, to upgrade your mask. You want to upgrade your mask to a KN95 mask, which is the mask that's shown there in the lower left-hand corner. You can buy, I just purchased a bag of 50 of these on Amazon for probably, I think about maybe $30, $30 or $40. So you really want to get the KN95 mask. Those are roughly 90% effective. When you, the surgical masks that are down there to the lower right, those are maybe 40% effective. When you get into the fabric masks at the top, those can be, 20 or 30% effective. So you really want to upgrade to a KN95 mask. Get one for every day of the week, and then just rotate it around. The Spirion half respirator, which is also at the top there on the left, that actually is an N100 mask that blocks 100%. That is actually what I used the 1 or 2 times when the pandemic first broke out, and I actually did have to fly. Just a quick reality check. Some people say, the mask is too uncomfortable. This is actually what occurs when we actually have to intubate someone. So in the emergency department, when we have to put someone on a ventilator, we use that stainless steel handpiece there, and that lifts up the tongue and that lifts up the back of their throat, so that we can actually put the tube in and actually put them on a ventilator. So that's actually what it looks like when we put someone on a ventilator. So that's not comfortable either. All right, when we look at the 6 clusters of COVID symptoms, this is what they are. Clusters 1, 2, and 3 are more likely to be able to go home and stay home, actually, and actually do well at home. That's flu-like with no fever, flu-like with a fever, and if you have vomiting, diarrhea, sort of gastrointestinal symptoms. Cluster 4, 5, and 6 are the ones where you get a little bit more fatigue and confusion, or you get a mixture of abdominal and respiratory symptoms. Those are more likely to be hospitalized. They're more likely to actually wind up in the ICU, and they're more likely to pass. All of these symptoms are often preceded by a loss of smell or a loss of appetite or a loss of taste in some way, shape, or form. Let me talk a little bit about the long-term effects of COVID, because you get the long-term effects of COVID no matter what, whether or not you were symptomatic or asymptomatic. So we're seeing this in people no matter how serious their original symptoms were. But one of the things that we're seeing is sort of a post-intensive care syndrome, where people have mental or cognitive or physical impairment. They've got chronic renal failure as a result of COVID-19, limb amputations. We're seeing strokes in the young and the old, with about half of the young patients cannot return to work. And then we're seeing scarring in the lungs, decreased lung capacities, where people can no longer walk a block or clean their house. And in some cases, they need a double lung transplant. Researchers have found a high level of coronavirus in the brains of mice, much more than in the lungs. And this may explain why some people who are not symptomatic respiratory-wise afterwards have problems with their memory, with their balance, They call them long haulers. And we believe that it might be related to the higher level of concentrations of coronavirus that are accumulating in the brain. As we've talked about, this is not the flu, right? The flu is a respiratory disease. COVID is a multi-system disease. Roughly about 26 million people have gotten COVID. Now, I would say, we can get up to 40 million people in a year that actually have the flu in the United States. However, the death rate is dramatically different. So at the highest year, we had 80 or 90,000 people die of the flu in a year. We've had 441,000 people die in 11 months. The year is not up. So we have another month of calculating that before we can actually compare it to a year of the flu. And we're already 400 times more deaths. So this is not the same. The other thing is that COVID-19 is distinct in that it's so contagious that we've had to shut down elective procedures. Almost 100% of the beds in the ICU are COVID patients. It's a multi-system disease, so we're getting renal failure, myositis, strokes, blood clots in the limbs, people requiring a double lung transplant, and we have people that we can't ventilate on a ventilator, and we wind up having to actually put them on ECMO, and I'll actually explain what that is a little bit later. So what happens if you just found out you got COVID? If you're on this for the first time, I just want to remind people, please, please, please get a pulse ox. The picture of it is to the right. They're about $20 to $30 on Amazon. The first number on the top is your oxygenation, the 97. The 104 at the bottom, that's just your pulse rate. So the top number, which is SpO2, that is the one that you actually want to look at and monitor. You want that to be 95 or above, assuming you're a healthy person. If you're a smoker or you're elderly, your numbers may be a little bit lower, but you would have to really sort of see what's normal for you. Zinc and vitamin D3, I'm recommending that everyone take these supplements, and the dose is there. I'm also recommending people quarantine for 21 days, not 14 days, because there are some people that are still positive after 14 days. If you want to check and get COVID tested, you can. We consider you to be negative after you've had 2 COVID tests separated by a 24-hour period. You want to make sure you have only a bathroom that you're using, a cell phone, where you can call for help. You'd call for 911, not call for family members. You want people to leave food at a closed door, open the windows to your room or house, and you want to also, if you can, change over to a HEPA filter in your home HVAC system. All right, so let's talk about what sort of treatments we use for COVID. Obviously, we give people oxygen if they're low on oxygen. Vitamin D and zinc we've talked about, specifically vitamin D3. So you can take a complex vitamin D or a vitamin D3. Then I'm going to talk about famotidine, dexamethasone, antibodies, and Equitable. Famotidine, everybody knows what that is. It's Pepsid AC. So famotidine is just the name of the tablet. Pepsid AC is what the drug company gave the name of. It blocks histamine release. So what's important is this actually decreases inflammation. The damage that COVID-19 does is all about inflammation all over your body. So this is associated with lower hospital deaths and lower combined death and intubation. Dexamethasone is a steroid, which does the same thing, also decreases inflammation and is associated with a lower 28-day death rate. All right, now let's talk about the cocktails, the antibody cocktails. Regeneron is the name of the company. It's not the name of the antibiotic cocktail. It's just the name of the company that produces the antibiotic cocktail. Eli Lilly also produces an antibiotic cocktail. So these are a combination of people who've recovered from COVID-19, plus also antibodies from a mouse that's been engineered to have a human-like immune system. It binds to the spike protein, which I'll show to you later, and it actually prevents the virus from actually attaching and actually getting into the human cell. Eli Lilly's antibody treatment was actually approved back in November. So there are these infusion centers where you can actually get the antibody. And this kind of shows the algorithm of who should actually get the antibodies, because what we're finding is that antibody treatment can decrease the rate of hospitalization by 70%. So first, if you're over 65 and you've had symptoms within the last 10 days, they will automatically give you the antibodies. Okay, so it's important that you have tested positive and had symptoms within 10 days. So the 10-day criteria is used for everyone. So I tell people, do not stay at home and wallow in your symptoms. If you begin to have symptoms, you want to find an infusion center. It is very, very, very important. 12 to 64-year-olds will get the infusion if they have a body mass index over 35, which is really not that much. That's probably a person that might be 50 pounds, 60 pounds overweight. Also, if you have chronic kidney disease, if you've got diabetes, or any sort of immunosuppression, diabetes type 1, type 2, so any risk factor, they will actually give you antibodies if you're 12 to 64 years old. Now let's talk about ECMO. ECMO is extracorporeal membrane oxygenation. Basically what this is what we put people on when they actually no longer can be ventilated by a ventilator. The blood basically goes out of their body, is oxygenated in this machine, and then put back into their body. If you actually have a COVID infection, you have immunity for about 5 months, 3 to 5 months. It varies in different people, so you can catch COVID again and again and again. It may not necessarily be it may be milder or it may be more severe. I've heard stories of both. So the woman that on the left, she caught COVID twice, and she survived. The 18-year-old on the right, he caught COVID twice and he passed. All right, so now let's go on to vaccines because there's a lot of stuff going on around vaccines. So just quickly so that we actually know how everything works. The orange dots inside the middle are the viral RNA. That is the virus. Then there's a fatty coating around it, which is actually the orange with the spikes coming off of it. The actual spikes are called the spike protein. So that spike protein actually connects to a receptor protein that is on the surface of one of your cells. It could be a cell in your lungs, a cell in your nose, a cell in your throat, a cell in your stomach. It doesn't really matter, anywhere in your body. So once the spike protein connects with that receptor protein, that unlocks the cell and it lets the virus into your cell. When it gets into the cell, it then begins to actually copy itself, and it copies itself over and over and over again. Now, what's important is during this copying process, the virus actually gets an opportunity to improve. So that's how you see the mutations actually form, because it's copying, and during the copying, it begins to improve, and it may create even a little bit stronger virus. So as it makes copies, then it reformulates itself, puts itself together, reconstitutes itself, and heads back on out and goes to infect another cell. All right, so RNA, basically there's all different types of RNA in your body, right? So I want people to realize there's a lot of things related to RNA. We're going to be talking about messenger RNA when we talk about the vaccines. And that basically is a messenger RNA is the protein that tells your body start to make copies of this particular material. Messenger RNA has been used before in medical therapies, but primarily in oncology, where you're dealing with the copying related to the growth of a tumor or a cancer. All right, so let's talk about how they work. Moderna and Pfizer both use a messenger RNA approach, which basically means that messenger RNA is coded inside the vaccine. When you get vaccinated, it tells your body, produce a spike protein. Then once it produces a spike protein, your body recognizes it as foreign, develops antibodies, and attacks it. You're not actually creating the virus, you're only actually creating the spike protein. Then when your body actually sees the real COVID-19 and sees the spike protein, it already has antibodies, and it will not allow it to actually get into the cell. Johnson & Johnson, which we've heard a lot about, and I've got a lot of information on Johnson & Johnson. So Johnson & Johnson is is the vaccine that just recently came out with their data. They have a viral vector approach. So that takes the virus, the cold virus, and actually alters it to become harmless, and then combines it with genetic material from COVID-19. The combination then teaches the body to generate antibodies, which then attack the spike protein. So the virus, again, cannot attach and cannot get into your cell. Alrighty, so this is what we put together because there has been a lot of stuff going on lately. Now, we've talked primarily in the past about Pfizer and Moderna, which offer almost the same effectiveness. The temperature requirements are quite different, and they're both 2 doses, and they have similar side effects. Johnson & Johnson, which is also Janssen, has an effectiveness of 72%. Now, when you look at that, you think that it's lower, but I want to remind people that the Johnson & Johnson vaccine actually tested in South Africa when the South African variant was becoming the predominant variant. So those numbers are associated with actually testing in South Africa where the South African variant was there. Moderna and Pfizer did not test in that environment. Johnson & Johnson is 1 dose. Headaches, body aches, and a little bit more rare is fever. Novavax is another one that is coming out. It is currently also releasing some of its data. Again, I still don't have Johnson & Johnson and Novavax in peer-reviewed data. It is 89%, 2 doses, and similar side effects. And then lastly is the AstraZeneca. It is a effectiveness around 62% and also 2 doses. Now, one of the things that we're going to add to this slide is not only the effectiveness, but it's also how much does the vaccine actually protect you against severe disease. So I didn't have time today to add that data, but I will tell you that Pfizer, Moderna, and Johnson & Johnson are roughly the same as far as being able to protect you against severe disease. But we'll add those numbers by Thursday. All right, a lot of people wanted to see the actual numbers. So this is what the actual numbers look like. For Pfizer, they had 37,000 participants. The average age was 51. They had 21% of the participants were over 65. 10% were African American, 82% were white, 26% were Hispanic. So when you looked at the people, placebo are the people that just basically, they got a shot of a water pill or something. And then vaccinated are the ones that actually got the vaccine. So you see the placebo, 162 cases of COVID, vaccinated 8. Placebo, 3 severe cases of COVID, vaccinated 1. So one of the other things about the Pfizer is that they did see that the incidence of symptomatic COVID lowered a little bit if people were over 55. And it lowered again a little bit if you were over 65. So I would say that if you are 70 or 75 or 80 years old, you may want to take the Moderna vaccine because we did not see this in Moderna. All right, Moderna, 30,000 participants, average age 51. Again, about a quarter of the people were over 65, 79% white, 10% African American, 21% Hispanic, similar profile. 185 people actually caught COVID that were in the placebo group. 11 caught COVID in the vaccinated group. There were 30 cases of severe COVID in the placebo group. There was 0 in the COVID in the vaccinated group. So this is what the actual numbers look like. Now, there was a whole framework for equitable allocation. The CDC is no longer using this. The CDC has recommended that anyone over 65 years old actually be vaccinated. Now, you'll have a lot of states that are not following that. That's their guidance. So there's a lot of states that are still going through this 1A, 1B, 2, 3, 4, et cetera. But the CDC guidance is anybody over 65 plus healthcare workers need to be vaccinated, frontline workers. Now, everybody says, oh, all of these vaccines are actually being approved. I just wanted to point out that there are vaccines that are not being approved. Merck actually ended development of its 2 COVID-19 vaccines because the initial data was not good. So there are vaccines that actually do not get approved and get denied and don't cut the mustard. Now, let's talk about how mutations actually occur, right? And so I want to actually, I'm going to actually show a slide a little bit later, and I'm going to actually, ask you guys a question and see if you can guess the answer to this. But mutations basically are occurring when there's a lot of replication, right? And then we monitor them with genomic surveillance, where you actually take the swab and you actually check the actual gene sequence and you see what's going on, right? And so basically our state labs have been so overwhelmed that we're doing very limited genomic testing at all. So because of that, we don't really know which variants are where or to what extent they are, but we do know what they are. So there's a UK variant that is now in over 50 countries. It has a small amount of alteration to the spike protein. It has about a 70% increased efficiency in entering into cells. There is a South African variant, which also which has a large amount of alteration to the spike protein. It's more likely to actually have a problem with the vaccine. In other words, it's more likely to escape and still make you sick. It also is more dangerous in children. This is why we're in a race against time to get teachers and other frontline personnel vaccinated. Then there's a Brazilian variant and a California variant. So if you look at this slide, this will tell you a little bit about why we have variants that are called the UK variant, the South African variant, the California variant, and the Brazilian variant. So I'll just ask everyone a little bit later if looking at the slide kind of gives you that answer, and we'll have a little discussion about it when the presentation's over. All right, South Carolina detected the first 2 cases actually of the strain from South Africa, since a 3rd case has been found in the Baltimore, Maryland area. So we now know that there are 3 cases. All 3 cases had 0 travel history. So that tells you that the South African variant is more widespread than we know. We're starting to see more complications with children, which we think also might be related to the South African variant. Children catching COVID and actually having symptoms is now up 16%. If you have kids, if you know kids, if your extended family has kids, I would not be sending any children to school right now. This just shows we've distributed about 52 million vaccines, and we've administered about 32 million. So we've done about 10% of our population. Israel has done about a third of their population and 50% of their adult population. So we have some ways to go, but I feel like we're actually moving with a lot more velocity. Mass vaccination clinics are going to play a key role in actually ending the pandemic. I think recently they said Red Sox, they were going to use a Red Sox stadium. Obviously, they're using Dodger Stadium. We talked about that. So there's going to be a lot of mass vaccination sites where people can kind of just drive up. We've got a rural medical center which started vaccinating school staff outside of the protocol. They were actually suspended for 90 days. All of their vaccines were removed and they were not allowed to actually vaccinate anymore. All right, this is actually, I want to show this video. This is also Dr. Fauci, and he is now talking about wearing 2 masks and how to actually make them comfortable. So I want to actually share this video because this is actually really, really important. Let me make sure I have it right.
Jane Tillman Irving, thank you, and welcome everyone to this installment of the New York Press Club's virtual speakers series. It's so great to have you all with us today. Now, before we get to Dr. Fauci, we would like to hear your questions. So please submit your questions. Here's how you do it. If you're in full screen,
hold on a second. I'm sorry, this is not the right video. Give me just a second. This is a 43-minute video. It's actually this one right here. I think we have a problem with the link. Yeah, this is I don't want to, the other one is 43 minutes. We are going to have to get this fixed. So I apologize for that. I thought we had this in there, but we do not have this hyperlink in there. So I will have to add that on Thursday. All right. So a lot of people ask me how to actually get my vaccine. If you go to your public health website, you can actually search on the COVID vaccine. Usually they let you put in your name, type in your name and address and your information. A lot of these things are time stamped. So as soon as you can get your name and information in there, the sooner you'll get your vaccine. I think that you will see in the next 2 weeks, these vaccines hit the retail pharmacies. When they hit the retail pharmacies, then we will, I think there'll be a lot more supply. It'll be a lot easier to get it. All right. All right. If you have gotten your vaccine, please, please, please send us your photo. We're going to be creating a new collage for Thursday. These are some of our heroes from last week. So a new collage will be created for the Thursday presentation. So if you got your vaccine, please send me your photo. All right. General Tedros just warns us that the COVID-19 will not be the last pandemic and tells countries to really prepare for the future. We've really got to put in things so that we actually, as a worldwide community, actually work together to notify and actually stamp out pandemics early. The earlier it's done, the better. All right.